Here, for example, a poor diet will underfeed the gut microbiome. The gut microbiome will not pass those nutrients pre-digested back into circulation. They will not arrive properly into the mouth microbiome. Then the mouth microbiome becomes disbalanced, doesn't analyze the information coming from the outside. Then we create abnormal inflammatory responses in the gut again towards the immune system. We have
Yeah.
more chronic inflammatory responses. We became more inflamed. And definitely that is related to every single chronic condition we know in the body.
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Good morning, everyone. My name is Jen Rivas, and as always, I am joined by my amazing co-host, Dr. Emmy Brown.
Hi, Jen. I'm doing well. It's gloomy here in San Diego, but I'm doing well.
The inner sun is shining. Well, ladies and gentlemen, get ready to witness the dental revolution in action because today we have a true visionary joining us. Dr. Haroldo Magarinos isn't your average dentist. He specializes in periodontics, oral medicine, and implantology. But that wasn't enough. He decided to push the boundaries even further and became a certified naturopathic doctor. Talk about raising the bar. So, with his unwavering interest in the human biome, Dr. Magarinos has become a champion in treating dysbiosis to combat chronic disease. He is a true pioneer, challenging traditional approaches and leading the charge toward a healthier future. Currently serving as a clinical consultant for Microbiome Labs and the co founder and director of Revolution Gut Health, Dr. Magarinos is transforming lives. His expertise in revolutionizing the way we think about gut health and its profound impact on our overall well-being is truly exciting. So prepare to be captivated. We would love to officially welcome Dr. Geraldos. Most welcome to the show.
I'm very happy to be here. Thank you so much for that very beautiful introduction.
Now, as a listener, I have to ask, we got to start with this question. As a dentist who specializes in periodontics, what sparked your interest in studying the human microbiome and its impact
It,
on oral
it
health?
started with a little bit of frustration on my end and curiosity on the other side. It was a mix of both. I was trying to figure it out how we were not able with the traditional methods to fix people, to resolve these chronic pathologies in the mouth. And we were doing exactly everything that was dictated in the books. We were doing everything that the research at that time was saying that it was effective, and it was not working. It was diminishing the symptoms for a certain amount of time. Everything was coming back later on. And that really was not a proper answer for what I was looking for in terms of human health. So I was very lucky. I connected with people that were in the same page here in the United States. I started traveling. I became more educated about it. And ultimately, I started figuring out that there was a connection between the microbiome in the gut and the microbiome in the mouth. And if you start fixing those, you will be regulating those areas for good. And you will definitely resolve these pathologies without the interventions of antimicrobials or any other destructive or more damaging therapy.
And what about the oral microbiome and overall importance, connection with the gut microbiome? Really just wondering what led you to believe it was the microbiome in these chronic diseases, both between the gut and the oral microbiome, that could really make a difference in these patients.
That it was a lot of dots that were
Yeah.
connecting over time. It was not really one aha
Yeah.
moment that became a realization in my life. I would love to say that, like I found the Rosetta Stone. It was not like that. I started working with some kids in the spectrum early in my graduated years, and I start seeing a connection between what they had in the mouth and other things we were already exploring in terms of the gut microbiome. That was one thing that caught my attention earlier. Uh, Later on, we start seeing some things like, for example, periodontitis or other expressions of inflammatory conditions in the mouth connected to depression, anxiety, and other types of disorders that were not supposed to be connected if we were looking just in the mouth. So that started, of course, making more obvious the point that there was certain degree of connection. And ultimately, the functions of the gut microbiome that I start studying later on, and everything that was also reported regarding the inflammatory conditions in the mouth, they were actually connected. So I start seeing, okay, the gut microbiome produces serotonin, for example, or dopamine, which are related to our mood, our behavior. But then we see people with chronic inflammatory conditions in the mouth that also they are highly related, they have a high related conditions in terms of mood and behavioral disorders and depression and anxiety. This is actually circling. This is all connected.
Mm.
And now we have really amazing studies that being done in the mouth and gut microbiome axis that are proving these points. And that's why it gets me so excited that actually now we have way more evidence that these hypotheses were actually true.
It's really fascinating. I'm excited. And I love when we make these holistic connections. It's great. So, how did this stuff present for the average person? How could an imbalanced oral microbiome drive disease to the rest of the body? And what are maybe some common oral health issues that you see that's caused by this
Well, the
dysbiosis?
mouth microbiome is the entry point. So I always see the microbiome as a modulator of information. It's like a processing engine for all the information that is coming from the outside. We know the immune system needs that information. So it's really a process of modulation that of that information between what is coming from the outside, what is presented to the mouth microbiome, and later on arrives into the gut. And that's where we have all these integration and the processing of all these responses in terms of a chronic or acute inflammatory responses. But everything starts in the mouth. So if we have a
Mm.
dysbiotic mouth, the initial processing of this information is not going to occur in the right way. And then it will arrive into the gut microbiome not well managed,
Mm.
creating probably um, these imbalanced or not the corresponding responses we need to handle whatever is happening outside. The other part is that the microbiome of the gut actually dictates how the mouth microbiome gets fed.
Mm.
So, on the other hand, if our digestive pathways are and our gut microbiome are not doing their part, our mouth microbiome doesn't receive the nutrients, and therefore it becomes dysbiotic. So you can start seeing that we can go back and forth where, for example, a poor diet will underfeed the gut microbiome. The gut microbiome will not pass those nutrients pre-digested back into circulation. They will not arrive properly into the mouth microbiome. Then the mouth microbiome becomes disbalanced, doesn't analyze the information coming from the outside. Then we create abnormal inflammatory responses in the gut again towards the immune system. We have
Yeah.
more chronic inflammatory responses. We became more inflamed. And definitely that is related to every single chronic condition we know in the body. So, yes, we
Mm.
can connect the dots pretty well and pretty tightly between the mouth microbiome and the gut microbiome. And that's just one example. There's so many actually.
And it's fascinating. And when we think about starting at the mouth, as you said, Dr. Geraldo, there's things like a deviated septum, mouth breathing, obviously poor dental hygiene, obstructive sleep apnea. So I'm curious in terms of course, we think about proper dental hygiene, but I think something we don't think about so much is the obstructive sleep apnea. And so
Mm.
for those cases, mouth taping has become something people are talking about. What do you think about taping our mouths at nighttime to prevent mouth breathing? I've seen that there's studies that show this can improve this severity of OSA. And I wonder how that impacts the oral microbiome and what you think about it.
No, it's I think it's a really good tool. Definitely there's more layers into that, but as an easy access tool for fixing the mouth breathing problem, I think is phenomenal because it retrains something that we got probably affected in our early lives and usually by chronic allergies or we have to think just the amount of particulate matter that we have in the environment right now, like so many pollutants. And that's
Mm,
something I'm really big into, the toxicological part of the microbiome imbalances. But if we think about all these environmental pollutants, we are definitely exposed to things that will trigger immune reactions in the sinuses and everywhere else in the airway, and that will block the normal way we breathe. And if we start changing the pattern of breathing, we start changing the ecological conditions that are dictating the balance of the microbiome. So one thing that has to occur is that we need the mouth closed for a decent amount of time, because that's when you flush a lot of the saliva that will feed the microbiome. You will reorganize certain
right.
things, because when this entry of air is coming in a massive way and not heated and filtered in the proper way, is going to affect the way that the microbiome is responding, and also on the side the immune system there. We have active immune cells here as well. So that's huge. And it will dry the environment, it will change the pH. And any person who has worked in a lab and seen a petri dish, and we try to grow something there, any type of bacteria, we know that if you don't put the right substrate, we don't put the food and the environment needed for that bacteria to grow, it will not happen. So changing the environment is fundamental for creating imbalances in any ecosystem, actually, including the mouth. Actually, more than probiotics, even though I use them and I like some of them, we need the right environmental
Mm,
conditions for rebalancing the gut and the mouth altogether. You will never grow what is right if you don't have the right environment.
right. And that's
So the
fundamental.
mouth, the breathing patterns is huge for that purpose.
Yep. I'm glad we touched on that because I think that's overlooked oftentimes. But something a little bit more commonly spoke about is fluoride. Obviously a huge conversation, right?
Yeah.
But we think about negative effects in the mouth with fluoride, but also systemically. Can you speak to this? I think that a lot of functional medicine practitioners think about fluoride as being an endocrine disruptor, but starting at the mouth, what negative impacts does fluoride have?
The binding of fluoride as an ion in and displacing the hydroxy part of the molecule, the salt molecule that is creating the enamel, and replacing that for fluoride, which creates fluoride apatite instead of hydroxyapatite, which is the natural salt that we have, or the crystal or the natural molecule that creates the crystals that are forming the enamel and giving the resistance, the strength for us to be chewing, biting, and doing all this mechanical strength. All these forces are supported by having this very, very strong structure. Now, the problem is that fluoride comes in, but doesn't stay for too long. And you have to have an ongoing intake of fluoride to keep that molecule in that shape. But we know all the other side effects. And actually, there's another problem. Making things too strong or stronger than what nature intended can actually make them more fragile.
Mm,
Now, this is the glass and rubber type of example. So we need the right elasticity model on those tissues to become just right enough to do the mechanical forces that are needed without breaking, without getting microfractures. So having something that artificially is trying to be promoted as stronger or more solid than the natural structure might not be a good idea. That's one thing. Then we have all the other systemic implications of fluoride use, and where it's coming from and how not natural is. We have a certain degree of exposure to fluoride in a natural way, but that's very minimum. Is way below what they're using on toothpastes, the pastes, and mouthwashes, and also, of course, in the water supply. That's is way more than what we naturally find in the natural water, spring water, or other sources like food sources. So that's one thing. The other part, of course, like I said, is the systemic implications that bind certain minerals and binds and leave them out of the body. which are essential for the immune system function, for neurodevelopment, for other things that we want, especially on young kids. That's the most complicated part.
Mm.
That is being promoted as an anti-cavity substance, but it's also affecting the neurodevelopment and the cognitive development of little kids. So I don't think that's a good trade. Even if the claims for strengthening the enamel were true, I will never replace the development of the brain for that. I think it's not a good deal.
Yeah, trade.
And the last part about fluoride is that actually what is being promoted in terms of the benefits can be achieved by good nutrition. We have a centrifugal force that occurs modulated by the pituitary gland. And one, for example, of the nutrients related to that is vitamin K2. So you have good amounts of vitamin K2. Yet the centrifuge circulation inside the tooth structure will actually grab minerals, will bind minerals into the tooth, and that will create a remineralization process. If you don't have enough K2, actually happens the opposite, and you start pushing out minerals. So if you want to remineralize your tooth, you don't need to get fluoride. You just need a good nutrition.
Mm.
And you will send all the signals, and the brain and the tooth structure will grab whatever is needed from the environment and keep the tooth structure stable.
And right there, we're talking about the connection to the gut in terms of digestion and nutrition.
Exactly.
So again, it all ties in.
I
And
love that
thank
you
you for
mentioned that.
explaining that.
Yeah.
Yeah. And now linking a little bit more to the gut, of course, we know drawbacks to oral antibiotics, but what about more topical or antibiotic-based toothpaste? What do you think of these products? I'm curious in terms of how that impacts the oral microbiome. I know that there's some opportunistic organisms that grow out on certain stool panels that primarily live in the mouth that we then swallow. They show up on these tests. And sometimes oral antimicrobials are recommended, usually botanical in the functional medicine world. But what do you think about that approach?
I'm a little bit controversial about it. I'm actually against that. And there might be a few situations where I will recommend antimicrobials. But antimicrobials are antibiotics. So we like to call them antimicrobials, or even better, botanical antimicrobials or herbal antimicrobials, because that sounds actually better. We think that we're creating a less amount of damage to the microbiome because they're natural. The reality is that we're not. We're using a very strong antibiotics in a natural form, but nature has very potent antibiotics, including, of course, for example, oregano oil, things like that. And the other issue comes with the fact that we use them for long periods of times because they're not restricted to a certain amount of time, like pharmaceutical antibiotics, because they have more regulated space for being used. 7 days, 10 days, that's it, most of the times. Herbal, they're not so regulated. So you can use it for a month, 2, 3. I've seen more than 2,500 metagenomic analysis in my life for microbiome analysis. And the amount of diversity loss after the usage of those natural antimicrobials is dramatic. It will be comparable to the strong antimicrobial or antibiotic you can find from the pharmaceutical side. It will be comparable to probably chemotherapy in some cases. Depending on the length of the usage, you can have very strong antimicrobial effects in the microbiome. That's to just put things in perspective in terms of the usage of antimicrobials. Now, in the mouth, what will be the situation why we want to use antimicrobials? Because we see in the genomic analysis in the mouth, something is being highlighted as high. And we recognize that bacteria as becoming or potentially pathogenic. But nothing happens isolatedly. Nothing happens just alone in the microbiome. So we actually see what we want to see. And probably we test for 10 or 20 or 30 types of different types of imbalances in the microbiome, we will get more information about the off ranges of different bacteria, and even more if we have the ability for testing for viruses and other types of microorganisms. Probably we'll see a lot of imbalances there too. So the reality is that it's not a bacteria alone that is causing the problem. And then we go after that bacteria with antimicrobials. We're killing thousands of other, or hundreds at least, of other groups of microbes, trying to go after that one single or a couple of microorganisms that we're pointing out as imbalanced or pathogenic. And we are blaming them for being responsible of creating the problem what we have in the mouth. When the reality is that we created an environment that became very favorable for them to grow. And they are just using the opportunities. If we change the medium in the petri dish, the same thing, we change in the environment. Now this guy can grow. Is it fair to blame them as the responsibles? I don't think so. I think that we're looking after the wrong guys. We need to fix ourselves. Our microbiome will become balanced afterwards naturally. You change the environment, you change everything for good. You try to go after these microbes, two things will happen. They will come back. If not them, others.
Mm.
Because we will dysregulate the environment over and over. So we will create better opportunities for other microorganisms that can be opportunistic to grow back later on. But also we see, and this is the argument I hear a lot, the symptoms went away. My inflammation went away. I feel much better. The antibiotics actually worked. No, what we did from the beginning, if this was oral microbes or gut microbes, doesn't matter. If we're suppressing the microorganisms responsible for providing the right information to your immune system, you suppress the immune system function. Therefore, cytokine expression and all these inflammatory molecules that are creating the symptoms. But that's a steroid at the end. That's the steroid function. That's a suppressive mechanism.
That's why they
of
feel
action.
better
That's
in
why
the
they
short
feel
term.
better for a while. So
Right.
exactly. So
Right.
are they really working? That's my question. Are they working
Mm,
because they're lowering those microbes, or are just they working because they're suppressing information pathways to the immune system?
yeah.
And I will probably bet for the second option. And the third part that is even more concerning is that the microbes, they learn very fast, especially bacteria. Bacteria are super fast learner, and they're very generous with the information they carry. So they pass it very fast for other microbes. And we know about those mechanisms in terms of quantum sensing and gene switching and gene swapping. We have learned about those. So we don't need more generations to pass that learning process. We can do transversal learning, which is something humans we can't do. And doing that, we will get more, let's say, knowledgeable microorganisms. So rapidly, the next generations, or the same ones that are living in the habitat we're trying to regulate, they will become more aggressive. We know even more that when we lower populations of microbes, the phages, this specific type of viruses we have regulating populations of bacteria, they can actually activate genes inside bacteria to make them more aggressive because they don't want to lose their hosts. So if you drop the population of bacteria up to a certain level, those phages will start activating genetic pathways, making their host slash bacteria more aggressive so they can defend better.
There's always a defense.
This is all happening inside our body. It's amazing. It's a miracle.
So I'm a proponent of really
Well,
balancing the microbiome from an environmental perspective. I think that makes more sense to me in the long run.
definitely. And before we dive a little bit further into that gut and oral microbiome connection, Dr. Geraldo, what tips can you give us? Because, we are a product of our environment and our mouth is no different and all the bacteria happening in there. What can you suggest to our listeners today to really help either them or their patients keep a healthy microbiome? Like, what are 3 to 5 tips that you tell most of your
Um,
patients?
the mouth breathing pattern is a huge one. So yes, that will be something I will always say: assess, analyze, check with your partner. If you're snoring or you have apnea, that will be even worse, of course. and check how your sinuses, how your nasal breathing is going on. If you're able to, some people are not. And some of them even will be candidates for surgery. And I understand that. But there's a lot of ways of correcting this. And I think that's something very important for overall health. So that's kind of like one of my priorities. Second, do not over cleanse. We need those microbes for modulating a lot of things, for producing chemicals and molecules that are needed for attaining an optimal health. We need those microbes for digesting or pre-digesting foods. We need those microbes for the immune system function. We need those microbes for so many reasons that if you think about how accessible this area is and how many antimicrobials we can put on a regular basis, we're really doing a very aggressive fight over them, more than what we can do on the go. Like every commercial toothpaste that is not aware of this type of issues, they do use a lot of antimicrobials in forms of straightforward antimicrobials like triclosan or chlorhexidine, or more natural ones like, for example, essential oils, which also are very potent for antimicrobial purposes. So that's one thing. And I'm not saying that you can brush your teeth, but it it is not really necessary to use toothpaste. Toothpaste is a cosmetic. And actually, we knew that from the time I was studying dentistry in the traditional way. This is not even my training as a biological dentist. Second, third year of university, I still recall this because, some things that they tell you, they really get you. So we all learned that you need to brush your teeth with toothpaste. Well, the research we have that time was telling us that there was absolutely no difference between the inflammatory markers in the gingival tissue between brushing your teeth with or without toothpaste.
Hmm.
Now, if I'm going to use toothpaste, I want something that provides benefits, which is almost not existent in the market. I want something that gives me nutrients, gives me things that will be beneficial, not subtracting my microbes and disrupting the environmental conditions in my mouth. And so that's why I usually recommend to brush your teeth probably once a day. It could be in every other day, and nothing will happen, I promise.
Well,
But from a cosmetic perspective, we want, yeah, we
Just
want
bad
to.
breath.
And bad breath actually occurs because we have already an established imbalance, and because of the type of foods we're eating. Because the most natural, you're not going to get bad breath by eating healthy, well-sourced foods. You're going to get it from more for the rotting process, for more this construction, the fermentation process that can happen, for other things that are not really that natural. But still, of course, we want to do this cleansing process. And actually, the mouth, including the way when we talk, or the saliva that is circulating the tongue, actually creates a lot of self cleansing. We have this process naturally occurring. Toothbrushes were not the standard until probably, I don't know, 200 years ago, maybe 300. I don't know how far you can trace them back. I don't remember the history classes in dentistry, but definitely there had not been here since forever. This is a modern invention. And so it is toothpaste. And mouthwashes, unfortunately, I will never recommend any of what is available currently in the market. I don't see any value. And the third thing is taking care of your gut microbiome. If you have a good gut microbiome, you have a good diet, of course, on the side, which is part of taking care of your gut microbiome, you will have probably a better mouth microbiome as well. And that implies your microbes and your digestive pathways, which is super important. You can try your best with probiotics and fermented foods and things like that, but if you don't break down your foods properly enough, you're not going to feed them, or you're not going to even maintain the terrain regulation that you need for creating those balances in the microbiome world. So your liver, your kidneys, your lymphatic system, your stomach acid production, all those things are so important to have a well-balanced microbiome, good absorption of nutrients, and then transportation of nutrients everywhere in your body, including the mouth.
I don't know if I want my
I
6-year-old to hear you say
know
you don't have to brush your teeth,
I'm
except
not the most popular guy when I'm saying this.
I'm okay. But I'm not, I mean, I learn something new every day. I think it's fascinating and it makes a lot of sense. It
I,
really
Absolutely.
does.
I just don't want people to think that the health of the microbiome in the mouth relies upon the toothbrushing, which is probably the standard
Mhm.
of care right now. Like, you go to any dentist, probably in the world, and they will tell you, oh, you have to brush your teeth 3 times a day. And this is literally mimicking that um, substructive, restrictive type of therapies that we see with antimicrobials, like the suppressive biofilm formation. And biofilms have been demonized. Biofilm is the most fundamental structure that we have for microbes to do what they need to be doing. We need biofilms, but because biofilms are so well organized and they're hard to take over, if they become pathogenic or imbalanced, that's why we look at them as this demon type of shape of a structure that gives us all this trouble. The reality is that biofilms can stay in the mouth, and we can just regulate the environment and the biofilms will adjust. Biofilms can adjust back and forth. It's not about that we get these imbalanced biofilms and we're not going to change them back to normal. That type of view is what drives us to create these antimicrobial therapies and all these other proposed therapies for lowering the diversity in the microbiome of the mouth and everywhere else. That when they establish certain imbalance patterns, we need to take them out. And that's not true.
And you're really touching on a whole different paradigm, Dr. Geraldo. And so I'm wrapping my head around it and it's really interesting. So I'm thinking in terms of testing and monitoring your patients, what are your go-to tests? Are there microbes in the mouth that you are testing for and monitoring? Does it matter? Are you clinically really diagnosing and assessing and monitoring more so? And kind of what's your approach there?
The mouth microbiome analysis is too complex because of all the different niches we
Mm.
have there. We have in every single type of a structure, we have a different type of pattern of growth. So we have in the mucosal areas, we have certain types. In the tongue, we have other types. And the palate, the gingival sulcus, all these different structures will hold different types of microorganisms. So when you do a genetic testing for the oral microbiome, you're spitting saliva. Most of those microbes are they're supposed to be transient, not really stable in the microbiome. So there's a little bit of probably misleading look at the oral microbiome by doing a salivary analysis of the oral microbiome because we're missing those established patterns of microorganisms we see in other structures that we're not analyzing. Because of that reason, I don't really use them.
Mm.
I prefer to go to the basics in terms of microbiome regulation. And will assume by clinical markers and other symptoms that there's an imbalance in the microbiome. And also, if I see a pathological microbe in the mouth or in the gut, to be fair, I'm not going to go after it. I know just there's a certain degree of imbalance. Some of them might tell me a little bit more of the story of what was going on in terms of the initial pathogenesis, but doesn't really tell me what to do. What to do is basic. And if we take care of the basics, you will take care of everything, regardless of the nature of the imbalance, because everything is self regulated to a certain point. We don't have the ability to modulate microorganisms in a biological way without disrupting microbiomes, without killing microbes in such a specific way that we see a strain of a microorganism and we will go after it specifically to lower that specific microbe and not taking care of not affecting others. The only probable therapy that is still in, I will not say on diapers, but It's getting very advanced at this point, but still not fully available, is phage. Phages are the only thing that we know that goes after specific microbes without touching others. But it's
That's
not really
wild.
fully available yet. So um, besides that, we're just killing massive amounts of microbes to make sense to me.
It's not root cause medicine at that point.
Yes, we missed the point there. That's what I want to say. So analysis wise, I don't think that they're so expensive, and I don't see the value. I see a value of the gut microbiome analysis for other reasons. For the mouth microbiome, you will need to take a different sampling of all these niches, and so we can have a proper assessment of what's going on in the mouth. But what we have right now available commercially with the salivary analysis doesn't really give me the type of analysis I need to understand in full what's going on.
Right. So maybe at the heart of this is more so looking at digestion markers, bile acid
Exactly.
metabolites, pancreatic elastase, what is the pH of the stool that might give us some information in terms of hydrochloric acid. You agree with that?
Totally. Yes, those things are really important. How we process our foods, even we can test for certain metabolites in the mouth. We can test for nitric oxide production, for example, or we can see how much our salivary flow is going,
Mm,
or pH of the saliva, which actually fluctuates, but still we can have a certain degree of analysis there that I will say is way more valuable than analyzing trace and microbes or salivary microbes. That's my take. And I know, again, I'm not the most popular guy by saying that, because most of the people are promoting oral microbiome testing because it's like the new cool thing to do. And but I have to be very honest. If I have to dictate a protocol with or without that information, that will change absolutely nothing of what I'm doing.
yeah.
I don't see any added value on the therapeutical approach. That's why, from a scientific perspective, it's interesting to see those analyses. From a therapeutical point, no.
Fair. So as we segue a little bit more into, excuse me, the gut microbiome and the connection with the oral microbiome, we think about digestion, we think about different types of diets. I've heard you speak on keto a little bit, and because keto, it's still very popular. And you mentioned a dichotomy in terms of using the keto diet for insulin resistance, for example, but the keto diet also having this negative impact on the gut microbiome in terms of insulin resistance. Also, I found that so fascinating when you brought that up. Can you speak to that a little bit more?
Oh, good. You're going to get me in trouble.
We got to make it in.
I'm not going to be the popular guy today. I know keto is super trending, and I have a lot of friends that are using that type of diet. But I was very, very honest in my perspective when I said that ketogenic diet for a short term, might be beneficial, but that's not the way we do things from a physiological level. We were probably going on and off on that all the time because of the scarcity and the availability of foods and the types of foods we had available, seasonally speaking, and also, of course, from opportunity. We didn't have animals all the time jumping in our camps or villages, and probably we didn't have all the crops and the products we wanted every single time. There's definitely not a supermarket around the corner for from an evolutionary standpoint until just recently, from the last 100 years. That changed everything in terms of our food choices. Before
Right.
that, everything was seasonal and locally grown, and there was a certain rhythm in the microbiome that was adjusted to that. When we use keto, we are focusing on nutrients needed for cells, for our human cells, mainly. So we're fueling our cells in a very specific way, using a very specific pathway. And we're relying mostly on the small bowel processing of nutrients. And we are neglecting this large intestine part of the digestive piece. because we're not really putting foods that are going to be fermented. And that actually happens mostly on the large intestine.
Mm.
So, from a human metabolic standpoint, we can survive using only the small bowel portion. But long term, or not even that long, that will affect the microbial populations in the large intestine because we're not feeding them. And that will change the patterns. And that will change also the way they use nutrients, or even worse, the way that they start looking for alternative sources of nutrients because they want to live as much as we do. And that's when they start going after the mucosal layer, the mucin 2 layer
Mm-hmm.
that is protecting the epithelium of the gut. And that triggers immune responses lately when we have no mucin layer to protect the gut lining. And that releases all these endotoxic responses, creates chronic inflammatory reactions, and then we get diseases associated with this underfeeding process of the large intestine microbes. That's why, and in relationship with that, those imbalances can also trigger an increased harvesting of calories. So whenever you eat something, it will be overutilized or transformed in an extra amount of calories by certain microbes, especially from the firmicute side, that can lead to, in the future, to insulin resistance or other metabolic disorders. Because everything is about compensation. You push the limits too much on one side, you will create an adaptation on the other side. So we can compensate whatever we're not given. So balance always is such a key word. Like everything in balance is the key for maintaining homeostasis. Everything else throws in, of course, imbalances, but also compensation mechanisms. And that usually creates a stress and drives inflammation. So
Right.
you don't want to get there. So ketosis helps if you want to go after certain things or lowering certain problems inside in your body for a short time. But if you go and keep in that and stay on that for long term, you will promote these compensation mechanisms that will promote inflammatory reactions.
And so it really defeats the purpose in a way if we're using these extreme diets long term.
Exactly. So you feel good for a while because your body is really good compensating. And also, it will create a detox reaction and it will create a lot of benefits in terms of cleaning certain pathways or maybe even more optimizing the way we use nutrients and energy. But we will be neglecting other things. For a while, that doesn't really matter that much. But long term is the problem. We
Right.
need to feed, in one point at least, those other areas and those microbes that are needing certain foods to survive. And the opposite actually is not even that. Too. We need both. We
Mm-hmm.
need That's why we have different stages. This is very organized. Small bowel, all about amino acids, all the absorption of proteins, all this liver and gallbladder activity, the pancreas, flushing enzymes, our microbiome and low diversity so that we don't ferment that much there. We allow the room for absorption of nutrients directly through the gut lining. We get those to our cells directly. And then the second part is all about fermentation. And now we're not absorbing nutrients directly. Those nutrients are not able to cross the gut lining alone. There's a need for fermentation, for mediating the utilization of those nutrients. Now we make our short chain fatty acids. Now we make our neurotransmitters, many other things. Place and time for everything. This is a very well organized, orchestrated process.
It's an extremely intelligent system for sure.
Yes.
Yeah.
All these extreme diets are focusing on one piece of the puzzle and they're pushing the benefits. Of course, they're going to find benefits. There are benefits there. It's obvious, but they're neglecting the other part. And even more, sometimes people are demonizing foods, which is, I think, is quite arguable. With a good balance microbiome and a good balance digestive system, you can handle all these foods properly. It's us, not the foods, that creates a problem. when it's good quality foods, of course.
And that's a perfect segue into feeding the good guys. Again, we need balance. So I don't want to go to the other extreme, which is what you were alluding to. But in terms of feeding the good guys per se, short chain, so for short chain fatty acid production, what's your favorite approach? I'm going to guess that it's dietary based, resistant starches. There are some supplements on the market now in terms of providing the raw potato flour, green banana flour. What's your favorite approach to for incorporating more resistant starch? Because that's typically not consumed as much as maybe, and again, could be a whole nother conversation because if we're really eating in balance, we shouldn't have to think about it. But how do you like to
Yeah.
incorporate more resistant starch if you do?
I think that diet should be the foundational piece. Supplement wise, we can compensate a little bit more when it's needed. But I think that with the right nutrition, we should be fine. Problem is that we don't have so much nutrient density anymore. That makes things a little bit more complicated today than before, because we need to eat more. That is actually demanding more stress for our
Mm,
body's pathways. So it's like having a very low quality fuel right now. The engine will run the same amount of time, but it needs a lot more fuel to make the same combustion process going on.
mm,
Here we have the same thing. For producing the same amount of energy, we need way more food than before. And that is really affecting us in terms of endotoxemia, microbiome imbalances, and stress in our digestive pathways. So that's one thing on the side. With that being said, if you have good locally sourced foods and produce, I will definitely focus on that. My my supplements, my if I have to choose supplements, I will try to avoid too much of fructooligosaccharides. There's actually a curve of benefits. So if you hit certain points, you will get benefits, but if you keep pushing the amounts of FOS forward, you might actually get the opposite. You might get inflammation at the site.
mm.
That's why inulin, that is usually added in every single product I know, is actually not that good for you. That's one thing. Now, the other thing is that food wise, we tend to eat a lot to try to compensate because we heard about this necessity of fibers. This is more about eating frequently in a consistent basis. The microbiome doesn't do that well eating such a large amount of vegetables all blended together, eating like the rainbow, they say. Yes, I agree, but don't eat the rainbow every single day. You eat the rainbow in a week basis, in a
Yeah.
weekly basis, or even more. So eat a couple of vegetables per day, not five, six, seven. The more complex your food gets, more stress you get into your microbiome. Your microbes can wait, so you can feed them certain types of them today, others tomorrow, and it's going to be fine. You're not going to struggle. This is a little bit different from what you usually hear, that try to eat as much diversity as possible every single time. That is too stressful. And I think a lot of the FODMAP diets and digestive issues for carbs are coming with this type of problems. We're pushing too much complexity in our meals instead of having a consistency in the intake of those products and those foods. And the
I
digestive part is also super important. Instead of eating those foods, we're drinking them. And if we go back to the initial conversation about proper stimulation of your mouth microbiome, getting things flushed and mechanically modulated with the chewing process and everything else we have here, you just bypass that if you drink a smoothie. It
Mm.
arrives right away in seconds into your stomach. Besides the fact that most of the smoothies are cold, which it will create a very negative effect on the muscle walls of the stomach. So it will reduce the space. It will create a lot of stress. There was no anticipation, no signaling process for the stomach to receive that amount of food. And also it's very dense. So now you try to handle those. Most of the people, I don't think they're going to feel well by doing so. So it's better to chew your foods if you want to really get the
True.
optimal nutrients from them. And also you will properly stimulate your digestive tract. That's, I think, is the key. Chewing calmly with enough time and eating a good amount of foods, but in a consistent way, not trying to eat what you didn't eat the rest of the week in one day. That's my
Like
philosophy.
think
Eat.
less about it.
Yeah,
Eat whole
exactly.
foods and think less. Mhm.
And I love the fact that I'm actually pushing this a lot. You have to have time for eating. I love the fact that in Europe and where I come from, we take an hour for eating. And people will say, well, you're super lazy. No, it's not lazy.
It's in touch.
That's exactly
Yeah.
what we need. Help.
Right.
And we eat with other people and we talk while we're eating and we sharing things. We're relaxing. This is our time for disconnecting. And that probably saves us a lot of money and time in medical consultations, therapy, and a lot of other things. Like people really disconnect and release and are able to absorb and use their nutrients better because they are in a completely parasympathetic state, or at least more into that. Where here in 15 minutes, you will never get that. And this
Um,
is a critic
so
that I'm trying to push because I think that should be a health concern, public health concern. It's not just a recommendation, maybe try. No, this would be something that probably legally should be established. People should have an hour or at least half an hour for having lunch in between their duties.
yeah, I'm guilty of it too. We're just so used to rushing through our meals and even eating by our desk. And I love what you're saying. And it's truly eye opening. And hopefully our listeners are digesting this, no pun intended. But we're going to take a little bit of a left turn real quick because I know we're getting ready to wrap up, Dr. Geraldo. But can you explain the concept of integrative biological dental medicine and
Yeah.
its role in your
It's
practice?
considering the human organism as a whole, integrated ecosystem within the environment. So it's not only us, but us with the environment, all connected. And understanding and embracing all these connections in terms of bringing health into the individual. That's the main philosophy behind it. That everything is connected from a physiological perspective. That every single part of the body, and also for of course, along with the environment that that person lives in, it is connected and is driving balance. And whenever something is going off or is getting affected, the rest of the body suffers at the same time. So when we do therapies, we need to consider all these connections and integration for addressing any type of imbalance we see in the body. And again, that means also assessing the environment, the family nucleus, relationships, everything in other hierarchy levels, not only physical, but emotional and psychological. When in that perspective, you can fully address and not only treat, but bring balance back to the person's life. And it seems hard, but it's achievable. I think the 80% of the success in any type of therapy or healing process comes from the willingness of the individual. The rest is pretty simple. When there's intention, there's solution.
And with that, I'd love for you to share, if you could, I'm putting you on the spot here, but maybe one or two case studies of patients of your own that you've sort of implemented this integrative approach and some of the
Well,
success that you've seen.
I own a lot to children in the spectrum because they taught me more that I can even thank in my life. They there's they're fascinating from the way that they teach us how we are connected to our environment and how the gut microbiome and everything else is receiving an information, how they compensate. But they do compensate to become integrated in a different way. We don't really understand in full what's going on. But um, but they taught me a lot about the gut microbiome connection with the environment. And one of one of the kids I saw for a couple of years, he's back in my home country, so I haven't heard about him for a while, but he was nonverbal, and he had the worst behavior ever. He couldn't express his feelings, so he was finding whatever type of pattern of expression to try to cry for help and ask for help of how he was feeling. And he and his family was so amazing because they trusted me, even though at that point probably I had a lot to learn yet. And we started trying whatever I could for helping them. And after a year, he was speaking in front of his classmates. And that was truly eye-opening. His family was everything. I just put a couple of pieces into the puzzle and they follow it. And they were really, really intentional in trying to make things better. For his son, they lost everything for him. And they did whatever he could for helping him out. But after a year, seeing that we were connecting back dots in terms of the gut microbiome, adjusting his nutrition, these baby steps, a year after, he was able to communicate. Not only that, he was actually talking with his classmates again, which was fantastic. And I think that was one of the most motivating cases. It was one of the most impactful human beings I met that pushed me into this direction. That's why they have a special place in my heart all the time. Like every time somebody comes with any kid in the spectrum, I'm like, I will do whatever I can. Like, I really own you, a big part of what I'm doing. And the other thing that and I want to share this because it's really important for the microbiome rebalance, is that lately I've been using a lot of toxicological analysis on the side. And it has been incredibly interesting that I was hitting a lot of walls trying to rebalance the microbiome. And then I started analyzing more and more toxins. And I start seeing people with toxins accumulated from 20, 30 years ago, like persistent pollutants that they could only relate the exposure to their early jobs. And there's one person that was working as a mechanic before becoming CEO of a big auto dealership. But he was a mechanic 20, 30 years ago. And he had huge amounts still of these gasoline derivatives and circulating in the body. And I start trying to fix him from a microbiome perspective, and I couldn't. He was having all these weird reactions, all these side effects, and it was super complicated. When I analyzed the toxicological part and I found all this, and we had this conversation, like he told me, well, I got probably this from that early job in my life. And we start detoxifying that person. Then everything else worked. So this is an additional note. Today, the environmental toxins and other pollutants are so dominant that if we don't address them as part of our protocols, it's very unlikely we're going to have a reversal and improvement at the same time in the imbalances of the microbiome. We need to take out the disruptive agents for the environment of those microbes to make them able to get rebalanced.
Great reminder. I think we're really touching on, again, the foundational pieces, which is chew your food, optimize digestion, optimize your nutrition, and look at the toxicants in our environment. We can test for those, of course. So thank you for bringing that up. That's such a huge component, and it's something that might be helpful to troubleshoot your difficult cases, as you mentioned, Dr. Geraldo.
Yeah.
So with that, I think we're going to wrap it up. We've learned so much. I'm so excited and honored that we had you on our podcast today. But we learned about the oral and gut microbiomes and how they're inextricably linked, the connection between them and chronic disease, practical steps for microbiome health, which bolsters optimal overall health, of course. And so now we like to have a little bit of fun before we send you off with 3 rapid fire questions to learn a little bit more about you personally and get away from the clinical stuff a bit if you are interested. How does that
Of course.
sound?
That sounds great.
Okay, great. So first one, what is your most memorable place you've ever visited and why?
That was Paris.
Mhm.
I loved it. It was an emotional experience because I met my wife's family there. So
Very special. I
yes,
loved it
very,
too.
very
I didn't
special.
spend enough time, but it's a very, very romantic place. Absolutely.
Yeah. And I'm a foodie, so that was additional benefit.
Same.
Good food there.
Love
Yeah.
that.
Okay. Number two, Dr. Haroldo, what's one thing you do every day that might not be normal by standard? I
No
think I
brushing
know,
my
not
teeth.
brushing your teeth.
No, I play music.
Mm.
Music is a huge thing in my routine, and it's not
Oh,
really a standard for everyone. But I dedicate decent amount of time for music. That is something that disconnects me and connects me at the same.
Do you play an instrument?
I play guitar
excellent.
and I have a diploma in electronic music composition. So I make music at the same time. So yeah, I love
Oh,
it.
Fantastic. And that's
Yeah,
good for the vagus nerve, right? So we're talking
yeah.
about gut
amazing.
brain and all of it is connected. So
Oh, that's it's fantastic. Yeah.
beautiful.
Mm.
Awesome. Okay, so last one. If you weren't a dentist and a naturopathic doctor, what career path would you have taken? Would it be completely different or would you still be in health? What do you think?
I will be a chef.
A chef?
Yes, I'm
Yeah,
not joking.
that makes sense. Of
That's
course.
how much I love food.
Like the same way.
I think there's a personal connection that brings me so much joy with food. And I'm enjoying the process even from picking the ingredients. I get excited when I see like really cool products in the market. I don't know how to explain that joy. And so then I'm so passionate about the initial part of the process of healing in terms of the food wise. But I will be a chef 100%. I actually thought about it seriously a while ago, but yeah, I stuck with this.
You're speaking my
Yeah.
language.
Awesome. Well, it was such a pleasure talking to you today, Dr. Geraldo. Let the listeners know where they can find more
I
out
have a
about you.
website. It's called revolutionguthealth.com, where all my information is there. So they can touch base with me, they can contact me or anyone in my company and help. We can try to help them out as much as we can possibly.
Excellent. Thank you again for being here. You have definitely opened my eyes, and I'm sure our listeners too. So we appreciate you being here and
It
hope to
was
have you
my
back
pleasure. It
sometime
was
soon.
great meeting you both. And yeah, anytime.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.